You know, when you look out over the long term, one of the goals, of course, is to slow healthcare costs over time. And there are a lot of cost control strategies that are in the bill. Just about everything you can think of is in the bill. And you know, one question that I get a lot is, well, gee, you know, aren't you enthusiastic that this is really going to slow healthcare cost growth because all of the reform strategies are in there? And yes, I am happy that all of those reform strategies are in there. I think that they're, you know, promising. But a lot of them, I mean, they're demonstration projects, pilot projects, things on payment reform, comparative effectiveness research. And I think they're certainly on the right track. The issue is that they may take an awful long time, and we don't know if they're going to bear fruit or not. Is there anything in these bills that actually scores these things, or what are the difficulties with that?
Yeah, I mean, I think a lot of the emphasis is really, we talk a lot about there's a big political risk with this bill because you have an expansion coverage that is increased and expensive, and then you have these cost control measures that are uncertain. And so the idea is, how do you make some of these ideas more certain in the future? And we've talked a lot here at Concord about this Medicare Commission, or the IPAB, which would review the research.
Independent Payment Advisory Board.
Right.
Okay. IPAB.
Yes. It would review the research on a lot of these pilot projects and things that we think might help lower the cost curve over the long term. And it would make recommendations, and those recommendations would actually go into effect unless they were vetoed essentially by Congress. And so that's the one promising aspect on these delivery system reforms, that we'll start getting some good information about what's going to work and what's not going to work. And then the goal is that this commission will be able to implement those, at least in Medicare. And then the hope is that private insurers will see what Medicare is doing to control costs, and it'll expand to them. And it really is dependent on Congress taking this commission seriously and not vetoing what their suggestions are over time. It's also essential that we start getting this information as quickly as possible, because these things are very complex, and the sooner we know what has a fighting chance of controlling inflation, the better off the government spending programs will be, and the better off the entire healthcare system.
You'll have a better Medicare system.
Right.
Not just Medicare, you'll have a better healthcare system.
Right.
So two really important things are that tax on making sure that the tax on high cost plans actually goes into effect, but that's not going to happen for a long time, and so there's reason to be skeptical there. The IPAB, the commission, is really important to make sure that this thing stays on track. So far, that has survived the process. There are some exemptions about things that it can't be done, but at least it's there.
Yep. So those are the two main things Concord's been focused on, really from the beginning, that survived in some form throughout the legislative process.
Yes, they're still there. They're still alive.
And maybe only a few weeks away from actually
so we'll see.
going into effect. Thanks a lot.